Hello you guys, it's Dr. Vidal here at Tuesday Tips. This is our weekly check-in. We meet every Tuesday afternoon to discuss different topics in plastic surgery and answer your questions. Today we're going to talk about drains. Drains is like a bad word for a lot of people. It's like, why do I need drains after my surgery? So we'll talk a little bit about why, the reason to put them on, how to take care of them, how or when do we remove them, and then we'll get some questions, okay? So why? Our bodies don't like empty spaces. So whenever we create a plane or separate areas, for example, in a tummy tuck, that we have to elevate all the, what we call the abdominal flap, which is basically the skin and the fat tissue from the muscle so we can do the muscle repair. That creates a space that it's basically the entire anterior abdomen. Or when we're doing liposuction, I empty the fat, and basically that space between the skin and the muscle is empty space while it heals. And while it heals is that skin needs to reattach to the muscle and obliterate or close that space. In the meantime, like I said, the body does not like empty spaces. So the body is going to fill it with something. What does it fill it with? It's called serous fluid. It's basically the component of the blood that it's devoid of the hemoglobin or the proteins, the cells, and that fluid looks like urine color. So it's like a very clear yellow, and if you had surgery, you've probably seen this. It's like apple juice color, okay? So that's called serous fluid. It's a fluid that it's filled with inflammatory mediators or inflammatory cells that basically promote healing. So it's actually a good response of our body to try to heal that space and close it down. But because I created, or your surgeon created, a big space, then for the first few days after surgery, when that space is still collapsing and healing, there's going to be a lot of fluid building up. The risk of not removing that fluid is that your body then encapsulates it, and that turns into a seroma, which is this serous fluid kind of creating a ball of fluid. And what happens is you can feel it, you can actually even palpate it, and when people palpate it, say it looks like a fluid wave, like you have some fluid inside. That's a seroma, and that's how it feels, okay? So the drains help drain the fluid to avoid seroma formation. You can develop seroma formation with a drain, it's just decreasing the risk, okay? The importance of the drain is really in that initial post-op period, okay? And to put or not to put drains is a very, very surgeon-dependent decision. Has to do with a lot of things. Has to do with where the surgeon trained, how did he learn to do the procedure, the techniques that he or she does to obliterate or collapse that space, okay? So one of the things that you may hear in social media, in surgery websites, is the drainless tummy tuck. What it does is you put some stitches to kind of obliterate or close that space instead of putting a drain. And that is why it's called drainless. Why I don't like to put those stitches. I've seen two things happen when we put those stitches on the inside. One is you're dimpling the skin, like cellulite in the abdomen, where those stitches are, it kind of dimples because sometimes the skin is too thin and you're creating a dimple from the skin to the muscle. Not everybody experiences this, but if you do, then it's very hard to correct because it's that scar tissue that formed that dimple or irregularity. And the other thing that I've seen with those stitches that we put for the drainless tummy tuck, they're called, for the stitches are called quilting sutures, just in case you guys have seen it or read about it. Quilting sutures, those sutures that I'm mentioning on the inside to obliterate the space, they may rupture. So in the first few days after surgery, if you do a movement or you stretch, it may pop and it may cause bleeding because the suture kind of pulls on the muscle and it bleeds and it causes a hematoma. I've seen that in a couple of patients, so that's the main reason, but I don't like to use the quilting sutures or drainless. So I use the drain. The drain, it's a little uncomfortable because yes, you have a plastic tube coming out of the incision. So yes, it's a little bit uncomfortable, but the decrease in seroma rate is a lot. So I basically don't see much seromas in my practice. Obviously, it's not zero. I do have patients that have developed seromas with drains. Like I said, it's not zero, but it decreases the rate of seroma formation. And the other thing is that when we remove them, that's it. We don't have the quilting sutures, dimples. We don't have the risk of hematoma, okay? So that is why I prefer to use them, okay? In what surgeries I like to put drains? There are two main surgeries that I usually use drains. One is in liposuction procedures and BBL, which involves a lipo 360 and fat transfer. Where do I put the drain? The drain, I put it in one of the lower abdominal incisions. So for lipo 360 or BBL, I put one drain in the lower abdomen. Why? I think it helps a lot with the massages in the early post-op period, okay? Some surgeons like to leave the incisions for the liposuction open and just work on the massages or rely on the massages for the removal of that fluid. And yes, that is one technique, but I think that some of those incisions close in some patients very early on, in 24, 48 hours, and the seroma or the fluid, serous fluid building up still lasts for a couple of days after surgery. So it's not in just those 24, 48 hours. You can see it up to 5 days after surgery. And having that drain there, it's basically all these little holes in the drain. These are going to be getting all that fluid and putting it in this drain. So the massages kind of massage all that fluid to the bottom, and this help drain towards the little ball. And I don't recommend reopening incisions because then we have an increased risk of infection, which is one I think some massage therapists do, and I do not recommend it because of the risk of infection. So that's why I prefer for liposuction to put a drain. Helps to drain all this fluid in the early post-op period. And some people say, oh, but you can create a scar or a thick tissue around it. Well, I remove it on post-op day 5. So really, there's not enough time to form a scar. And then you're going to continue with the massages afterwards, which are going to help, if anything formed, to break it out and avoid having scar around the drain, okay? So for every lipo patient or BBL patient, you're going to have the drain for 5 days. So when you come for your follow-up appointment, I'll remove it before you go back home, okay? For my tummy tuck patients, it's different. Why? Because as I explained, I have to elevate all that plane so the entire abdominal wall is kind of separated between the skin and the muscle so I can do the muscle repair, especially in the center. So that's why I put 2 drains. One drain is going to come in the upper part, okay? So it's going to go like this to drain the upper abdomen. And the other drain on the other side is going to come in the bottom, okay? Both drains, I exit them through the corners of the incision, okay? And I'll keep the tummy tuck drains until they're draining less than 25 cc's in 24 hours, okay? Why? Why 25 cc's? Well, we've seen that that amount of fluid, your body is able to absorb it, okay? Anything more than that can accumulate and form a seroma. So that's the reason for the 25 cc's in 24-hour period, okay? How long? Well, I said I answered this question already, but I'll repeat it. How long do I leave the drains? 5 days after a liposuction or BBL procedure, and between 1 to 3 weeks after a tummy tuck. Why not more than 3 weeks? Well, at 3 weeks, usually there is not enough fluid that your body is not able to absorb, and we end up with increased risk of infections. Having this drain for a long time then increases the risk of infection. So by 3 weeks, if it's still draining more than 25 cc's, I'll ask you to check the amount. I'll ask you to check the color of the drain. We'll talk a little bit about different things that I'm going to look, but most of the time I'll ask you to remove it, okay? And that is the reason. How do you care for this? One of the things that scares most of the patients and taking caretakers is, what do I do with the drain? Well, the drain is very easy to take care of, okay? This part you're not gonna see because this white part is gonna be on the inside, okay? So you're gonna see from more or less here, right? This tube and this little ball on the outside, okay? It's gonna be sutured in, so a suture, and that's usually the only suture we have to remove on tummy tucks. The rest of the incisions are closed with absorbable sutures, so you don't have to remove. And with the liposuction, we'll remove all the little stitches on the follow-up appointment, including the stitch, okay, for the drain. But basically here, and from here to where the drain is, you'll have to strip the JP drain. What is that? It's very simple, okay? You're just gonna hold the drain close to your skin with one hand and putting a little bit of alcohol in your hand or ointment, cream, lotion, anything that makes it a little slippery, not on the stable hand, on the other hand, and with 2 fingers, you're gonna do like this, okay? And that's basically milking or stripping the fluid on the inside to avoid clots of blood or pieces of fat to block the leakage or the drainage inside, okay? So the important part is to hold it tight, close to the skin. If not, you're gonna be pulling the drain out, and that's gonna be a little painful because the stitch is there. So hold it tight with one hand close to your skin and then pull, okay? Once you reach this point, you can switch this hand closer and pull again. And you're gonna repeat this movement until you reach the little ball, okay? Once you reach here, you're done with stripping, okay? The other thing is, how do you empty it, okay? So when you see the drain like this, the ball is open, so it's not suctioning, okay? To put it in suction, you're gonna open this little valve, okay? And then you're gonna squeeze the ball, and squeezing it, you're gonna close it. This creates negative pressure, and the ball should look like this. Like this is when it's suctioning, okay? When it's opening, it's not suctioning. So when it's attached, it should look like this at all times, okay? To drain or to discard the fluid, easy. You're just gonna open it, and you're gonna see how much it has, and then you're gonna empty it. You can empty it in a cup, in the toilet, and flush it, okay? And then remember to close it. If you just go ahead and close it like this, it's not suctioning. So remember, squeeze it first, then put the little tap on. When it's like this, it's suctioning, okay? And that's it. How many times a day you should empty it? When it's full. Usually when it's not, you shouldn't wait until it's like overflowing, but half of it or a little more. Usually the first few days you'll have to do it maybe 3, maybe 4 times. Usually when the days go by, twice, and then at the end, maybe 1 time a day is enough, okay? It depends on how much you're draining. So this too we talked about, and the criteria for removal, this is for the tummy tucks, so this is not, this does not apply for the lipo BBLs. This only applies for the tummy tucks, less than 25 cc's in 24 hours, okay? Usually, we're able to remove 1 drain for the tummy tucks when you come for the follow-up appointment on post-op day 5, and usually you go home with the other drain. Some tummy tuck patients go home with both. It depends on this, okay? So when you're coming for your follow-up appointment on day 5, empty your drains. Let's say if your appointment is at 9 in the morning the next day, empty it around 9 a.m. the day before and leave it, okay? Don't empty it. So when you come here for your follow-up appointment, the drains will be in without emptying for 24 hours, so we know if we can remove them or not, okay? And then what if you go home with a drain? Not a big deal, okay? We have videos and we have clear instructions on how to remove them. A lot of our patients have a family member remove them for them because it's not very difficult. It's just, like I said, this is what you're gonna see on the outside, and it has a black stitch holding it. The black stitch, you just need to cut that stitch, open the little valve here, okay? That's important so it's not on suction. And then you're gonna gently pull this out, okay? It is not as painful as it looks. Trust me, I've removed a lot of these drains, and the 99% of patients are like, that was it. I really didn't feel anything. So it looks more painful than it really is. And like I said, a family member usually can do it, okay? Remember to wash your hands and clean it with alcohol prior to manipulating the drain in the drain area. Sometimes people complain that it hurts or it pulls where the drain is coming out. So my advice is always see if you're pulling the drain. If you're pulling the drain at the skin exit, you may be irritating the skin. Always, you see this little thing, this little clip, is so you can clip it in your skin, in your faja, so it's not pulling. So the drain is always in loose here and not pulling like this, because then you'll irritate the end of the skin. If it's a little red, irritated, you can clean it with alcohol or saline and put a little bit of antibiotic ointment, and that's gonna help. But the majority of the time is be careful when you're sleeping or where you're putting the faja that it's not pulling on the skin exiting site, okay? And if you have any questions, if you see any redness, anything, always send us a message through Clara and we can answer your questions, okay? I hope all of this helped out. I'll get some questions now.
Okay, well, let's start with the first one. Hi, Dr. Vidal. Do you put drains on implant removal or breast lift? If so, for how long, and do they hurt?
That's a very good question. So for breast procedures, I don't usually put drains, but if we're doing an explant, so removal of breast and capsule, and there is a lot of empty space, I may need to put one drain, but I'll let you know. If I'm doing a breast lift with the implant removal, most of the time I don't need to because everything is kind of tightening in, okay? I don't put drains with my breast lifts. I don't put drains with my breast reductions. The only case is on an explant, and I'll let you know before the surgery.
Have you had tummy tuck patients that were able to remove both drains post-op day 5?
Yes, very, very rarely, but I'm able to. It all depends on this, okay? I've had very, very skinny patients that don't have a lot of excess fat. It's just excess skin. And those patients usually don't accumulate that much fluid. So yes, it is possible, but I don't want you to be holding on that thought. Usually you go home with one.
Okay, hi, Dr. Vidal. Excited for my surgery next month.
That's awesome.
Can you shower with a drain in?
Yes, I do allow my patients to shower. There are some surgeons that will tell you not to shower until the drains come out. I think that's a little too much and a little uncomfortable to be not showering for 3 weeks. But I do allow my patients to shower. For a tummy tuck, I don't want you to shower or get the incisions wet for 48 hours. After 48 hours, shower is okay, but not submerging in water. So if you usually take a bath, don't just shower. Let the water run over the incisions, pad dry it, and that's it.
Do you combine BBL with a tummy tuck? This question is in Spanish, so maybe we can answer a little bit in Spanish.
I'll do both, okay? So I don't like to combine these two procedures. There are a couple of reasons. One is safety, okay? So I operate an office-based surgery center in the state of Florida, and there's a limit of 1 liter of fat removal when I'm combining procedures. And I don't think 1 liter is enough to give you a good result with a BBL. The second reason is recovery, okay? The recovery for a tummy tuck is laying on your back so you don't put pressure in your abdomen. And the recovery for a BBL is laying on your stomach so you don't put pressure in your back. And I don't think to optimize both results, you can actually combine this, okay? So I do not. Most of the time, 99% of the time, I recommend doing the tummy tuck first and then doing the BBL, okay? I'll answer it. Ahora lo contesto en español, okay? So, la pregunta es si podemos combinar la abdominoplastia con el BBL, que es la liposucción con transferencia de grasa. Yo no los combino y hay 2 razones por las cuales yo no combino estas 2 cirugías. Una tiene que ver con la seguridad del paciente. Yo opero en una sala de operaciones que es basada en la oficina. y hay unas regulaciones del Departamento de Salud de la Florida que no me permiten remover más de 1 litro de grasa cuando estoy combinando procedimientos. Por eso con la abdominoplastia hago liposucción, pero solo localizada en el área de la cintura y los flancos, que usualmente eso remuevo de ahí 1 litro y entonces no me da para ser suficiente para hacerte una lipo 360 con lipotransferencia y que tenga un buen resultado. Y la segunda razón es por la recuperación. La recuperación de la abdominoplastia es que estés acostada boca arriba para que no le pongas presión al área de la incisión. Y con la lipotransferencia de los glúteos te voy a decir lo opuesto, que no te puedes sentar en el glúteo, sino que vas a tener que estar por las 6 semanas poniéndole presión al abdomen. Así que en realidad no veo cómo podemos combinar estas cirugías de manera segura y de manera que te puedas recuperar lo mejor posible para que los dos resultados sean óptimos. Yo recomiendo separarlas.
Do you use drains for arm procedures? I guess brachioplasty or body tied to the arms?
I don't. There are a lot of surgeons that use drains for the brachioplasties. I don't. I usually just put you in a compression early on, and for arm lipo, massages will be enough, so I don't put drains in the arms.
After a tummy tuck procedure, have you had patients experience a passing out feeling when getting out of compression to shower in the early post-op days? If so, how do you avoid it?
It may. It has to do, it's something called orthostatic hypotension, okay? So orthostatic means that it changes with changes in position. Your blood pressure may go down when you change positions or release the compression. Orthostatic hypotension has to do with your hydration level, okay? So that's why it's so important to be well hydrated after surgery to avoid those orthostatic changes which may happen when you release the compression, okay?
Okay. How to take care of the pubic area after a BBL when it's swollen?
That's a very, very common area to get swelling. So the two most common areas to get a lot of swelling after lipo360 or BBL is the pubic area and also the area just above the buttock and that triangle. The reason for that is gravity. Everything kind of goes down and builds up there. What to do? 1, the compression. The compression is going to help out. 2, massages, okay, massaging that area. We're going to give you a triangle that you're going to put in the area above the buttock, okay? That triangle is going to help with that compression. You have foams. The foams you can put a little bit lower in the pubic area to reach the compression in the area where the swelling is. But the majority of the swelling will come down with time. Just give it time. Your body's going to, with massages and time, the compression, your body's going to start absorbing this serous fluid and inflammation will decrease and you're going to pee it.
Should I keep washing with Hibiclens after surgery?
No, you don't need to. There are patients that want to keep using it and you can. Hibiclens is it's recommended to use before the surgery. Why? Because we want to decrease the bacterial count in our skin. One of the most common or the most common cause of infection after surgery is bacteria that live in our skin, okay? So Hibiclens helps decrease the bacterial count that we all have bacteria in our body. We all have bacteria living in our skin, and that's actually good. But before surgery, we want to decrease that bacterial count to decrease risk of infection. Afterwards, you can switch to regular soap. If you want to keep using the Hibiclens, that's fine. But it usually causes irritation because it's a strong soap. So if it's causing irritation or dry skin, you can stop it and switch to regular soap.
Okay, can I be too skinny for a BBL?
Unfortunately, yes. So the BBL relies on the removal and transfer of fat. If you're too skinny, you're not going to have enough fat to, 1, see a result in your contour, in your waist, in your torso, and you're not going to have enough fat for me to transfer, okay? So what is the limit on their lower BMI end? I do recommend being at least more than 21. Close to 23, 24 is ideal, but lower than 21 BMI, you're not really gonna have enough fat and you're not gonna see a result.
After the mommy makeover procedure, I know it typically includes lipo flanks. Could lipo be performed in the pubic area as well?
Yes, I
At the
sometimes
mons,
on the mons, yeah, that area on the pubic area is called the mons pubis, and yes, most of the time it's either ptosis or droopiness of the mons and or excess fat. So it is an area that I target and repair or improve with the tummy tuck, and it depends. Sometimes it's just lifting it and it's not excess fat, but if you do have a combination of excess fat and droopiness, I do lift it and do sometimes some liposuction to this area to flatten it so you don't have a little bulge in that area at the end.
Okay, and the last one, we're almost at the end.
Yes.
I have itching and discoloration in my left breast 6 months post-op breast lift and reduction surgery.
Okay.
Will that ever go away? And if so, when?
So, I mean, I'll have to evaluate your case specifically because 6 months after the surgery, the incisions should be healed and you shouldn't be having any problems with the skin or the incisions at that point. What couple of things may be causing that? You may be having some reaction to a product that you're using, some type of dermatitis or reaction in your skin. So that specific case, just give us a call or write us to Clara to help you out. But it shouldn't be something dragging out after surgery for that long. Okay. Awesome, you guys. So. Thank you, Willie. Willie's like my guardian angel. Remember this, remember that. So thank you so much, you guys, for joining and all the questions. I hope this helped decrease the anxiety around drains. It's something that people are always anxious to go home with drains, and it's not that difficult to manage, and it has a lot of benefits when we do use it. I also wanted to remind you guys that there is a promotion, Valentine's Day promotion. It's a very good one. So if you're having surgery with me in the month of February, you are going to be eligible to go in a raffle to win a cruise, a weekend cruise for 2, okay? So if you are considering surgery, or if you're booked for later on, think about it, because you may have surgery sooner with the possibility of winning a cruise. So contact us if you want to change the dates, because there are still some openings in February. And if you do, then good luck. And I'll see you guys next week, okay? Thank you so much for joining. See you in next Tuesday Tips next week. Bye-bye.